Did it start?
Hold on, let me.
Is it for you?
Yeah.
It's not,
To be
no, I don't
understated.
want that I am like going around like putting bad energy or bad,
Hey folks, it is 2:01, so I'm going to go ahead and start. We have a lot of people here. I'm so glad to see that. So the format I'd like to follow is pretty informal, but I'd like to just I'm going to give you a little bit of background around FACT because a lot of folks are not familiar with us. So if you are familiar with us, you can zoom out of your of that part of the meeting if you need to, for just a minute or two, because I think it is important to know the context and how we operate around and where our funding comes from. So you're going to have a better idea about how this grant opportunity works and why it works a little bit different than a lot of other grant opportunities. And then I'm just going to go over the highlights of the application, and then we have some questions that some of you have sent in that our senior research associate, Taylor Holy, is going to ask me, and I'm going to respond to those. So if you have any questions, if you could maybe make a note as I'm going through, and then if they're not answered by the end of the session, we'll see how many folks we have here, but if it's manageable, then you can just raise your hand and I'll call on you. Or if you're more comfortable, feel free to put the question in the chat, whatever works best for you. And feel free to, if you want to, I love seeing your faces, but if you're eating lunch or something, then feel free to turn your camera off. This is really just to make sure that we are as clear and as helpful as possible about this process. So with that, I'm going to go ahead and start. My name is Nicole Pouland, and I am Executive Director for the Family and Children's Trust, or FACT, of Virginia. And we also have here today Taylor Holy, who is our Senior Research Associate. Just a very brief background and understanding about FACT. FACT was created in 1986 through Virginia State Code, and it was created initially to serve as Virginia's Children's Trust. Children's Trust in the 80s were kind of the phenomenon that developed out of the work of a pediatrician in the Midwest who was seeing a lot of child abuse and neglect cases. And at that time in the 80s, there wasn't any kind of government municipal funding available for any kind of prevention of child abuse and neglect. So he started this whole idea about states creating these trust funds where they had flexible funding that could go towards preventing child abuse and neglect. Since that time, there has been funding allocated through state and federal governments around this. Some of you, I think, are probably very familiar with some of that funding, the CAPTA funding, CBCAP funding, that it comes through the Department of Social Services. So FACT was this little entity that was created, and basically the way I describe FACT is that it's a bank account that sits in the Department of Treasury in Virginia, and it is overseen by a board of trustees who are appointed by the governor, the House, and the Senate in Virginia. And so for most of our existence, that board was solely appointed by the governor, but as of last year, there was a code change. So now the appointment duties are split between those three areas of government. So that board of trustees is in charge of making decisions around the funding. And so the three kind of categories that FACT does is that, and when I say FACT, I'm really talking about the board of trustees, is that they are kind of an advisory board. So they provide advice to the governor and the Department of Social Services on issues that impact family violence. I forgot to add that when FACT was established in the 80s, Virginia went off course a little bit, as Virginia does sometimes. And our trust fund was established not just to prevent child abuse, but to prevent family violence across the spectrum. So that's a very broad scope. So it's child abuse, domestic violence, sexual abuse, and abuse against older adults. We also have historically provided prevention efforts across the prevention spectrum. So not most trust funds are focused on more in primary and secondary. We do everything. The board has historically supported all types of efforts. So we have a very broad scope. So FACT is the bank account that's overseen. So the three kind of categories is FACT provides advice around issues related to our mission, to the governor and Department of Social Services. We also then act as kind of a coordinating, communicative entity between state agencies around some of these issues. So if you want to check out our website, we have some really great reports and data. We love data and policy. We're policy nerds, and we love working collaboratively across different areas of focus to try and lift up families. And then the third thing is funding. So FACT is grant funding. We do grant, historically that's been done in all different ways. And I'm going to get into that in just a second, but just so you know where the funds for FACT come from, it truly is a mix between a public-private partnership. So our money that in the Department of Treasury comes from our license plate program. So if you've seen the kids' first license plates, look at Taylor. Taylor's got the little license plates up. Go buy one, put them on all your cars, because the money from those goes into the FACT account. And we also are on your state tax. When you do your state tax in Virginia, we're a tax checkoff option. We also get usually a small amount of individual donations. And then recently, in the last few years, we were added to the casino bill in Virginia. We get a very small, very small, which is actually not that small for us, percentage of the casino proceeds. So it really is a mix between public and private funding. My role and Taylor's role, and we are the only staff that support all of FACT's operations. We are employees of the Department of Social Services. So the Department of Social Services provides administrative support for FACT for the Board of Trustees. And the commissioner for the Department of Social Services in code is a permanent member, not a voting member, but a permanent member of the FACT board. So that is our affiliation with social services, which is why we're employees of Department of Social Services, but our job is to really report to a board of trustees. It's a little unique in Virginia. The other unique part about us is because of the way our code is set up, our funding is set up. Although we are not tied into the state procurement system, so those of you who have gotten grants through the Commonwealth of Virginia, you have worked through EVA and you've had procurement things done. They have automated, they access your organization's bank accounts, they transfer money. FACT is not connected to that system. So our money is very old school. The way we pay people is with a hard copy check that is sent via US mail from the Department of Treasury. So that's kind of a challenge we have, because we haven't really been able to figure out how to get the technology up to date. So we're not tied into that system, but we are required to comply with state procurement laws. So those of you that have worked with even federal or state, gotten those types of municipal grants, know that procurement processes are a little bit more burdensome than like private foundation processes. So we have a pretty steep administrative requirement for allocating our money. And we rely on the Department of Social Services and their procurement department to provide that technical support for us. So what that means to everybody in the Commonwealth is that it's kind of hard for us to get large grants out. So anything over $10,000 for fact is pretty hard to get out because we have to go through a formal RFP process, which takes a very long time because of our structure. I might be way too in the weeds for some of you, but I just wanted to go over that in case anybody had any questions about why we're not doing larger grants. The board is prioritizing that this year. We're working on that process this year, and our hope is to have a larger RFP released next year for organizations to apply. But I always like to tell people that we want to get it out, but it's hard, just the structure. So what the board has done is come up with this ad hoc. So because of the structure, the way state procurement is we can allocate up to $10,000 in a pretty expedited way. So the board still has to, I mean, I don't spend any money. I don't have any authority to spend any money unless the board of trustees votes on it and tells me to do it. But they can do that pretty quickly for amounts up to $10,000. So we've had in the past, some of you might be familiar with our ad hoc grants in the past, where we had started out at like $2,000 grants, and then we moved it to $3,000 and then $5,000 grants to support training types activities. And a lot of that has supported a number of conferences or state conferences around the state and other types of things over the years. And I'm really proud of the board for supporting that work. The one good thing, and we have a lot of good things about FACT, we also have a lot of challenges, but our money is not as restricted, which is always interesting because I think that's the hardest thing for folks to kind of grapple with when you're applying for our money is like, what are all the restrictions? Because those of you that do those, I used to work in other state agencies and I used to work at nonprofits. So I've been on both sides of that when you're worried about all kinds of things. And we have a little more flexibility with regard to the restrictions and the flexibility that the money can be used for. So that's kind of the long and short of that, and that's why we're here, because this is a brand new process that the board has created in order to support this updated ad hoc process. So the way we are rolling this out is that instead of doing quarterly, our board meets quarterly, instead of doing quarterly awards for up to $5,000 of ad hoc grants, which is what we've been doing. And that was primarily for those types of trainings. They've developed one process that is 2 different pots of money folks can apply for. So I assume everybody's taken a look at the application. And I did note I think what we're going to do is we're going to post the actual application in a PDF. So you can go through and read it and not have to like pretend to go through the application to see the questions ahead of time. Because that I can see how that's a little confusing. So we're going to do that. But basically, the 2 pools are, the first one is $5,000 for training, and that is, again, pretty flexible. So that can go to those conferences. It can also go to training or organizational capacity building. So like smaller nonprofits that are just starting out or don't have a big budget could use that for things like strategic planning, could do it for like training for your staff, like management training or other continuing education training that's really critical for your staff, that type of capacity training type of thing. And it also can be used for conferences. Or so if you want to have like a community event or anything like that, that's also what that pool is available to support. And then the other pool of money is up to $10,000, and all of these are up to, you don't have to apply for the whole amount if you don't need it. And that is for service expansion. So again, that's flexible, but when we say that, that could be for direct service support for if you're servicing clients. So like if you want to use it for, say, rental costs or car repair costs. We have in the past had these emergency grants that we've done the last few years for certain targeted groups. And those were really like direct financial assistance for folks that you're serving. And that's paid for all kinds of things that there's no other money for. Like we paid for formula during the formula crisis when there was no, I mean, we haven't, the programs that the money did, you know, diapers for people in emergencies, hotel rooms and domestic violence programs. We paid for like unpaid parking fees and traffic fees so people could get their license back so they could go to work, car repairs, like that type of flexible direct financial support for folks that you're working with in your community. Could be used also for, you know, transportation. It could be used for legal services. If you're like a DV program, that I used to work in DV programs, I would have loved to have access to some money to help cover the costs of a consultation with some attorneys if you don't have one on staff. Those types of services. And I mean, we say staffing support. So I don't see any one of the questions is around preclusions on using it on your existing staff. I don't see any prevention in that. This application was developed in partnership with our grants committee and they approved this. So I would say to go ahead and request it. I would encourage you though, like not to supplant funds. Like if you have money from DCJS or something to pay for somebody's salary, then you know, don't ask for fact money. But if you want to expand hours, pay for overtime, childcare, anything like that, I think that the board would be open to considering that. So yeah, that's the overview of everything. And I think we can get to the questions. Taylor, do you want to just start asking me some of the questions we got in, and then we'll take questions from the field.
So yeah, thank you all for those of you that submitted questions ahead of time. The first one that we have kind of talks about that flexibility piece that you were asking, and says, this person said that they would like to know if there are any items that this grant specifically would not cover, for instance, salary, which you just mentioned, but are there any parameters of something that it wouldn't cover?
So as I just mentioned, this application was developed and really by our grants committee. So what I would say is there are not in this application. I would say that this is a new process for FACT. And so when the grants committee reviews the applications, they may make some further determinations at that time that, like, you know, we don't really want to pay for this person's salary if they've had money for it, or, you know, for 10 years and all this, you know, I never know what they're going to say. So I would say that there are not. I would say to please just use your judgment around that. That's kind of the best I can do.
I would say it doesn't really hurt to ask or try to apply.
Oh yeah, it doesn't hurt to ask.
Yeah. All right, so for our next question, is referring to the training funding. Do you have to list specific trainings on the application, or can you just say trainings as they become available? And they also asked about the maximum amount to be requested, which is $5,000 in the instance of trainings. But
yeah, so it's $5,000 for training. And what I would say is I would encourage folks to be as specific as possible. Because I think that, you know, the board is trying to do their due diligence on being good stewards, and they want to make sure that you're not sending your staff to Hawaii to like go to some, I don't know, basket weaving conference or something. Not that anyone would do that, but I would encourage you to be as specific as possible.
Our next question, there's two pieces of this, but the first part is there anything that would disqualify an organization from applying? Is there anything that would disqualify an organization from applying, and is it a one-time payment reimbursed at the end, or does reimbursement occur as you periodically submit invoices?
Right. So it's reimbursement. All of our money has to be, that's a state thing. It's all reimbursed. We can't front any money. And so the way your organization has to be able to front the money. And then after you complete the project, whatever the project is. So you're going to say, you know, in the next year, we're going to send our staff to this training. At the end of that training, once your money is up, you would submit an invoice with a report to me. And then, like I said, we're old school. So then I'm going to send that invoice to the Department of Treasury with a letter, and then they're going to cut you a check from the Commonwealth of Virginia, and it's going to come through the U.S. mail. So it's not a very speedy process. We are pretty good. I will say I'm always impressed with the Department of Treasury, like genuinely, because they are really good at trying to get things out the door as fast as they can. So usually, I mean, I always feel comfortable saying you should receive payment within 30 days.
In terms of the service provision stuff that might be a little more ongoing, would it be possible to like submit invoices for like partial reimbursement? I think that might be what this person's trying to ask.
Yeah, I would say no, unless there's like an exceptionally extraordinary situation, because that is a very hard administrative burden. If I start getting into that, where some people are giving me an invoice every month or from a grant management perspective, unless there's like an exceptional reason you can't do that, then I'm going to say no. I'm going to feel comfortable making that call. Because this is, again, I just want to reiterate, fact is 1.7 staff. So we do everything. So our capacity is limited. We don't have like somebody that's handling our invoices, and we don't have we do it all. And so that's why I can't be as flexible as oftentimes folks would like, because it's a struggle sometimes just to stay on the administrative processes we have to stay on top of. Having said that, if there is an exceptional situation for your organization, then please contact me directly and I'll see if I can work with you.
Our next question, which I see that we're getting some questions in the chat, so thank you all for those. But our next question is, what types of nonprofits or organizations can apply? And is there anything that would kind of disqualify people from applying?
So I think a good tool, the answer is there really aren't any. A good tool for folks to keep in mind is on our website, we actually have a really cool page that's our prevention page that Taylor created, and we kind of stole it off of SAMHSA's work on the prevention spectrum. But if you look at that spectrum, we kind of divide prevention between primary, secondary, and tertiary. It's a public health model. And so primary prevention is it's a universal strategy. So you can apply if you're providing some of those more universal things that is connected with building stable families, which is a prevention strategy for preventing family violence. So that's it's a pretty broad scope.
Trying to see if there's any of these that we haven't touched on yet. And
again, I'm sorry, I just want to have a caveat. I mean, within reason, right? If your nonprofit is set up to save the elephants or something, don't submit an application of fact. I have to put that in there.
I think the only one that we have left from the previous questions before we get into the ones from the chat is the one about the final summary report and saying that the summary report seems to be a bit more geared towards a one-time activity. What would the reporting requirements be if this was a service provision?
Yeah, I saw that question, and I think that it's actually I think the questions could be answered through direct service. So you just need to, so the questions are, as we have, is how many folks participated in the activity. So if you're expanding services, how many additional people did you help? And then what impact did the funding have on the activity and the organization as a whole? So if you're expanding services, we were able to house X number of people in hotels. We were able to cover these unexpected costs. We were able to reach more people, like whatever. I think you can answer these for direct services too. I mean, I understand it's kind of more geared towards events, but I think that they, and then what evaluation summaries or reports are collected, as well as any pictures. You like pictures. We're trying to get better with our social media stuff, you guys. So that's why we ask you to share your pictures and like us on social media, because we really are working hard and trying to get the word out about FACT. And so it's important for us to be able to share kind of the impact of our work. We haven't been really good in the past in doing that. So yeah, I mean, and some of you, I don't know where you're all from, but I am looking, I would bet you guys, a lot of you are already doing a lot of reporting for your existing funding. So like if you're a domestic violence program, you're probably doing reporting for DSS, DCJS, like you're probably doing a lot of reporting. If you have any of that reporting related to the service that has been expanded, or the community that you're touching, or how this funding impacted it, I think that's something the board would be interested in seeing. And if you're doing any internal, like questions of your clients, or any kind of internal survey information, if you have that established, the board just wants to know, like, how impactful is this money on the communities that you're serving. So does anyone have any further questions about those questions while we're on that? Are there any in the chat?
Yeah, there are a couple questions in the chat. Yeah.
Okay. I mean, but specific to the reporting.
Doesn't look like anything to the reporting. There is a question about our grant cycle, whether it's calendar year or fiscal year, which is fiscal year, state fiscal year.
It's state fiscal year, but I'll tell you, it's not really it, because the other thing about FACT is that our money doesn't have to be spent like in the fiscal year. So if you're getting state or federal money, you're going to have a very specific. So in the past with this type of funding, we say you have a year to spend it. So it's rolling. It's a biannual award, but it's rolling, if that makes sense.
Yeah, I think just for clarification, in case this is what the person was asking, in terms of like the cycles for applications, those would be fiscal year. Like
right, and the cycle for applications for this fiscal year are outlined in the deadline. So there are going to be 2 reviews, one in September by the board, and then one in March. So the applications are due at the end of August and at the end of February for those 2 cycles.
Okay, we have a question from Jackie here. Can we pay for training for our behavioral health providers who are pre-licensed? And then if so, what types of conference expenses are allowed? And then there's a secondary question about if you can apply for both organizational capacity and service support.
So you can pay for training for your behavioral health providers who are pre-licensed. You would just be as specific as possible about that.
Okay.
And I mean, it's up to the board if you can, but it's permissible in this application.
Okay.
And I'm sorry, can you apply for both? So yeah, I mean, it's interesting because we've actually gotten a couple applications from a few organizations, and so I would say you can, yes. I don't know if you'll get it, but you can. My read of the application was that you couldn't, that it says 1 ad hoc award per fiscal year. That was my read of it, but I don't think that that's as specific, or as, I think that there's room for clarification on that. So if you want to submit for both, you can.
Okay.
I mean, if you can also, if you are interested in letting me know if you'd like to provide context around your 2 applications around which is a higher priority, you can send me an email about that. You know what I mean? So like if they make a
Yes.
determination, because again, this is all new, like they're gonna make some, potentially the committee and the board have the option of making some different ideas around kind of what they want to do with, not drastically, but you know, some of these fine tuning, some of these specific questions. So if they make a determination in September that they're only going to fund 1 application a year per
Okay.
organization, then
Uh,
if you want to provide context to me around which would be a priority, if they have to pick one, that's fine to do that.
Okay. Okay. Thank you.
And I will, just for the record, because this is being recorded, I am going to reach out to any applications we've received for both and let the folks who have already submitted application know that they can also provide that information to me to pass on to the committee and the board. What else we got?
We have a question about if the funds can be used to support putting on a conference, which is, yes, that is kind of a little bit more geared of how these ad hoc grants used to be, is more like putting on trainings and conferences. So that's definitely something that can be done. Okay. And
What kind of
then-
expenses are allowed under that with the conferences?
That is the wonderful thing, is that it's very flexible. So it
We
can cover
we can
food.
speakers, food, everything.
Speakers, food, speakers travel. We paid for scholarships for folks to attend conferences to cover part of the cost of the conference, to open it up to a broader scope. The board
Wow.
has been very flexible on that. I know
Thank you.
those of you that get state money, all that, like no food, no food. I remember like policing people about water. You couldn't buy like iced tea with state money at some point. So yeah, that's the great thing about us.
Right. There's another
I
question.
would say, I would feel so comfortable saying that you cannot cover alcohol with FAC money. I would feel very comfortable saying that. Please
Yes.
do not do that. Please.
That I did know.
Our next question that we have is somebody who says, I am with a behavioral health docket, wondering if you need to be a nonprofit to apply for this grant.
Yes. You need to be a nonprofit or you need to be partnered with a nonprofit. So if you, so in the past, we have a program that I think you can look at on our website. FACT has done this. The board has supported a pilot program called Skyward, where a nonprofit connected with court service units working with juveniles. And that nonprofit was providing that direct financial support for some of those juveniles who had been, or youth who had been involved in the juvenile justice system, through a referral process with their service providers through the court service units. So like juvenile probation officers would refer a kid and say, this kid is doing great, they need money for tutoring or a computer or something like that. And then nonprofit would front the money and then we would reimburse the nonprofit. So that's what I mean when I say partnership, is that if you have like a partnership with a nonprofit, you could do that. Because sometimes it's hard for local governments to deal with this type of money. Like they don't know what to do with a check. They're, ooh, everybody goes crazy.
I actually think Skyward creates a good transition here. Our next question is, would FACT funds be able to support an organization that provides restorative justice for youth charged with crimes and families involved in violence-related crimes?
Yes. With the caveat that obviously it's evidence-based or evidence-supported type of service, which I assume it is if it's being done through a formal organization.
Next question is, if agency is currently receiving FACT emergency funds, are they able to also apply for these ad hoc grants?
Yes.
And then someone else has asked, can you apply if you are a fiscally sponsored program?
If you're not a nonprofit or a local government, you are not eligible for these funds. I don't know what that means. If someone would like to hop in and clarify that, I'm happy to provide more. I don't know how else to respond to that.
Can you hear me?
Yeah.
Okay, yeah, that was my question. So we are under the umbrella of a nonprofit. We're a project underneath of them, so they're considered our fiscal sponsor. They have the EIN, but we're a program underneath of them.
Yeah, so you would the board has supported those types of things. So that organization would actually apply, but then
Okay.
you would just the way if you get any other money that you would just be specific in the application that it would be going for this specific program. But it would be that organization that the contract is with.
Right. Okay. Great. Thank you.
So it's that organization that's applying on your behalf.
And a related question, Ashley has asked, is local government okay? It's saying on the website that it's ad hoc support for local government and nonprofits.
Yeah, local government or nonprofit. If you can get your local government to let you, then go for it.
We have a question about if this would support services for people with disabilities or if it's limited to children, which you touched a little bit about our scope.
Yeah,
earlier.
no, absolutely. In fact, if you look, please check out our website. FACT has been very supportive of that community. We have a project that right now, a contract right now with VCU's partnership for people with disabilities to expand their sexual assault prevention program for folks with intellectual disabilities. The FACT board has been very supportive of helping that community. So please, yes, absolutely. That is a community that is so often neglected. And the same with seniors. Like if you're servicing seniors, we are across the lifespan. So please don't feel prohibited if you're helping folks in any of those categories. I think someone has their hand up. Did I see a hand?
I think Alex briefly had the hand up, but I don't know if that was a question or.
Will it support gala funds?
I'm sorry?
Will it support gala expenses?
I didn't understand what kind of
Oh,
expenses.
I'm sorry. The Women's Center has a gala each year. Will it support gala
Oh,
expenses?
a gala.
Yes.
I mean, you can apply. You can apply.
Similar to the question about the emergency grants, somebody has asked if you're eligible for the ad hoc if you were awarded the CSA prevention grant.
Yes. We love our CSAs.
All right, and looks like the last question we have so far in the chat. Oh, we just got another one. But this question is, how many grants will be awarded, and is this typically a competitive grant process, which is a little new? So, if you want to speak on that.
So right now the board is allocated $300,000 total, and so I'm not good enough at math to be able to figure out like they haven't set a limit on how many 5,000 or how many 10,000, they're going to award. That's the amount in the budget that's been approved. So the board has the authority. I don't know if they'll do this, but if we get a huge influx of grants, they have the authority to increase that amount, like at a board meeting, to allow for additional funding. So there isn't necessarily a cap on that, but they also have the authority to say we want to use that money for another project too. I don't want you to think that they have unlimited, that this is an unlimited opportunity, but they have that authority. And yeah, so that's kind of the answer to that. And it is competitive. I mean, that's it. The process is the grants committee is going to meet before the board meeting, and they're going to have reviewed everything, discuss everything, vote on their recommendations, and they're going to bring that recommendation to the full board to vote on. And that'll happen by the end of September. And it is competitive, because if it wasn't competitive, then they would, if you've gotten emergency grants from us, then that's not competitive. That's like if you meet the minimum threshold, you get it. This is different. They're reviewing applications and discussing them and then determining what to do.
The last question that we have so far is the funding only for expansion of services, or could it be used for existing services?
It says expansion of services. Doesn't it? Doesn't it, Taylor?
Yes, I think it does.
It does.
Yeah, I would maybe
Well, it
tack
says
on to this.
supportive direct services. So, I mean, it doesn't actually say expansion. So if you want to use it for existing services, then, I mean, you can request that. I would say that, again, getting back to like, we don't want people supplanting funds. So if you have money that can cover and you're just trying to loosen up your budget, I would say that they would not be supportive of that. But if you're losing money for a critical service and this is going to help you get over a hump till you can fundraise or do something to get that money back, then I think that that's something that they would consider.
Those are all the questions that we have so far. If anyone wants to put more in the chat or raise their hand to unmute.
All right. Last chance, anybody, feel free to. Oh, look, Joy. Joy's hands up.
Hi.
Yes, I'm sorry. Can you hear me?
Oh,
Hello. Can you hear me? I'm on the telephone.
Yeah, we were just taking a question. Can you hold on for just a second?
Sure, I can.
Hey, Joy, what's your question?
she can go ahead. I can pause.
Okay. Oh, okay. Jump on in, new caller.
Oh, all right. Yes, you said, okay, so I think I heard this is a one-time payment for reimbursement, and at the end you submit a report and documentation of expenditures, correct?
So at the end, you're going to submit an invoice, and just an accounting statement from your whatever accounting system, like QuickBooks or whatever, and then your report. And you'll get a hard copy check sent to you.
Okay. So now you had said that I was on your website a couple of days ago. Are you saying that you were going to send a link to see the whole application rather than seeing it as if you're applying? You understand what I'm saying? Can we see the whole application?
Yes, we will post at the end of this call. We will post a link to the PDF for the application.
Okay.
So you can read through everything.
All right. Thank you.
There we go. Okay. Hello, Joy. I work with Latinos in Virginia Empowerment Center here in Chesterfield, Virginia. We service the entire state of Virginia when it comes to domestic and sexual violence. We definitely work with DSS often, and we love you guys. But wanted to, that was part of my question is, of course, can we see the application as a full thing, which is great. So that answered one part. And I think the other part is kind of, I think I'm just a little concerned about like expansion or existing because like we have so many new things and coming things and starting new programs, but it's all towards the same thing. Like we're all going towards the same goal or mission. So with a new program that we pay for upfront, I just hope they wouldn't see that as, oh, well, you've been funding this in the past and it may not, and it's like, oh, but that grant is over. You know what I mean? So I'm guessing if the grant is completing, will they see that as a potential opportunity?
Yeah, so it doesn't actually say new or
Okay.
expanded programs. So that was my mistake. It does not say that. The application does not say that. And so if I were you, I would say, and there's a word count cap. So
Okay.
we do that on purpose because nobody wants to read 20-page applications. I mean, some people do, but we do not have the capacity for that. So I would make it a priority to say in that narrative section that just explain, this is a program, this is a position that has been funded, and due to ABC, that funding is no longer available to us. Okay. Our goal is to access this money. We have a plan. I would include a plan for sustainability that we're currently working with some of our foundation partners or whatever to continue after the end of this grant, like to make it clear that so the board, you're letting them know that you're not expecting them to give you $10,000 every year, but this is kind of just bridging that gap. So that's what I would recommend you do if you're going to do that. My guess is the board is going to be supportive and flexible and understanding that funding is changing on a lot of landscapes right now. And so my guess is they're going to be supportive of helping that work continue.
Thank you. Thank you so much.
Anyone else? Please, I want to say this last thing. Please fill out the application through the system. Do not send me an attachment for an application that you took you took the questions and you put it on a different piece of paper. Don't do that. You have to go through that automated system because we are really trying to streamline our administrative processes. So please do that. I think honestly, that's why I was a little hesitant to post that, which we should have posted it, but because I've gotten a lot of applications where people don't use the format we provide and they just write the questions and they go over the word count and it's a different format for our files. And in the past, I've been able to be a little more flexible with that, but it's just too much of an administrative burden. So please use the system there. And if you don't, I'm going to be mean and say you have to if you send it to me directly.
And if you have any issues about that, in terms of using the Microsoft form, I'm going to put my email in the chat and you can email me if you need any assistance with it.
Yes, we are very accessible. So feel free to reach out with any questions. Is there anything else?
Yes, yes. For some reason, my Microsoft Teams was not working today, so that's why I'm on my phone. But could you say your email, please? Your name and your email, the lady that we could contact if necessary.
Yes, sorry about that. Yeah, my email
is that possible?
Taylor. Yeah, it's Taylor TAYLOR HOHLE@dss.virginia.gov.
Thank you.
Yeah, of course.
Okay, I saw your name on. I didn't know that was the same person. Thank you.
Yeah, and if you go to our website, there's actually how to contact us. There's both of our emails, and then we have a general email, the fact email.
Yeah. Okay, I see it. I'm sorry. Yeah, I see it now. Okay.
Anything else? All right. Well, I'm so glad we had such a good response. I really appreciate y'all taking the time to attend and give us your questions. And appreciate all the work that you're doing to support families and kids in Virginia. So keep doing what you're doing, and let me know if you have any questions.
And the recording of this will be posted on our website if you want to refer back to it, or send it to anybody else in your organization that might be interested. So that will be up
and
hopefully
please
later
us on
today.
social media and like us and share stuff about how great we are. Thank you all. Have a great afternoon.